Toothbrush and oral hygiene aids have evolved through ages. Over the years, many dental myths have been doing the round regarding toothbrush and other oral hygiene methods. So let's take a look at all these dental myths and try to unravel it by backing it through scientific researches. Some say brush harder to clean better. So, does the force of your brushing affect your teeth? As we all know, teeth are made up of hard tissues as well as soft tissues. Enamel and dentine are the hard tissues that make up the tooth, and gums or gingiva are the soft tissues that surround the tooth and hold them in their sockets. Although toothbrushing is considered a prerequisite for maintaining good oral health, it also has the potential to have an impact on tooth wear, particularly with regard to dental erosion. The toothbrush alone appears to have no effect on enamel and very little on dentine, and most toothpaste also have little effect on enamel, and in normal use would not cause significant wear of dentine in a lifetime of use. But applying inadvertently more force while brushing can damage your gums. They can get irritated and further progress to recession. And it's not only the soft tissues that are affected, but also the hard tissues, as excessive force can cause erosion of the enamel surface of the tooth. Hence, in order to maintain the health of your gums and your teeth, it is imperative that you brush your teeth with adequate amount of force and not overdo brushing. Now, let's take a look at a study which was done by Addy M. and Hunter M.L. Can toothbrushing damage your health? Effects on Oral and Dental Tissues, published in the International Dental Journal in 2003. According to the authors, wear of enamel and dentine can be dramatically increased if toothbrushing follows an erosive challenge. It is only under over or abusive use or when combined with erosion that significant harm may thus be caused. In normal use, it must be concluded that the benefits of toothbrushing far outweigh the potential harm. So, though excessive force can cause damage to your teeth and gums, that doesn't mean that you shouldn't brush. You should brush with the proper technique and with proper amount of force. In another study by Wigand A. and Sclutter N., the role of oral hygiene does toothbrushing harm, published in Monogram Oral Science in 2014, the author stated that toothbrushing frequency and force, as well as toothbrush hardness, were shown to act as cofactors in the multifactorial etiology of non-cervical carious lesions. Tooth abrasion can be influenced by the physical properties of the toothpaste and toothbrush, and also patient-related factors such as toothbrushing frequency and the force of brushing. So after toothbrushing, now let's talk about flossing. So I brush daily and even twice a day. So journey to floss. Well, there have been studies in the past which have stated that even with the proper technique of toothbrushing and using the proper toothpaste while brushing is not able to completely eradicate the plaque and debris in the oral cavity, especially the ones between your teeth. This makes flossing an indispensable part of an effective oral hygiene routine. Dental plaque is a bacterial biofilm which causes chronic gingivitis and periodontitis. Gingivitis can lead to bleeding gums, and retaining of plaque between your teeth can also lead to halitosis or bad breath. And nobody wants that, obviously. Flossing helps to remove plaque as well as control its accumulation. In a study by Zapata, Winstein, Blacketier, and Lynch, published in the Journal of Clinical Periodontology, Association of Flossing or Interdental Cleaning and Periodontitis in Adults, they stated that a higher percentage of subjects who flossed no more than once a week had periodontitis compared with subjects who flossed more often. After adjustment, the odds of periodontitis were 17% lower for subjects who flossed more than one time a week than for subjects who flossed less often. Flossing was associated with a modestly lower prevalence of periodontitis. So, this study came to the conclusion that flossing regularly leads to lower prevalence of periodontitis and thus maintaining the health of your gums. So, we are done with teeth and gums. What's left? Your tongue. Tongue is a strong muscle, a soft tissue, which is captured between the hard tissues, that is your teeth. and it is imperative to maintain its vitality. So, as it is important to clean your teeth and maintain the health of your gums, equally important is to clean your tongue. The microorganisms which get retained on the surface of the tongue, they form deposits on the tongue, and these deposits can form VSCs, which are the volatile sulfur compounds. This can ultimately lead to oral malodor or bad breath. It is estimated that approximately 85% of all halitosis cases have their origin within the mouth, and of these, 50% are caused by tongue residues. Thus, tongue cleaning gains importance as a means of halitosis management. In a study by Dwivedi, Torvane, Tyagi, and Maran, published in the Journal of Contemporary Dental Practice in 2019, effectiveness of various tongue cleaning aids in the reduction of tongue coating and bacterial load, a comparative clinical study. So the study was conducted to compare the effectiveness of a manual toothbrush that has a tongue scraper on the back of its head and two commercially available tongue scrapers in reducing the tongue coating and aerobic and anaerobic microbiota of the tongue dorsum that helps in reducing oral malodor. All tongue cleaners showed a significant reduction in Winkel's tongue coating scores with significant values of reduction of the anaerobic bacteria count with plastic and metal tongue scraper when compared to brush scraper. So the authors concluded in their study that there was an effective reduction of bacterial load on tongue dorsum with the use of tongue cleaners with maximum load reduction by using plastic tongue cleaners. So you should definitely clean your tongue daily. In another study, tongue cleaning methods, a comparative clinical trial employing a toothbrush and a tongue scraper by Pedrazzi, Sato, De Matos, Lara, and Panzari, published in the Journal of Periodontology 2004. The investigation was done to compare the efficacy of two mechanical methods for tongue cleaning through a handheld sulfide monitor. This crossover trial was carried out with 10 healthy subjects, 20 to 50 years old. The tongue scraper showed a 75% reduction in VSCs, that are the volatile sulfide compounds, while the toothbrush only achieved a 45% reduction in VSCs. So they concluded that although the tongue coating was removed by both methods, the tongue scraper performed better in reducing the production of volatile sulfur compounds. So now finally, let's talk about mouthwash. Mouthwash is harmless, so that means that I can use it any number of times I want, isn't it? Well, broadly speaking, there are two types of mouthwashes: cosmetic and therapeutic. Cosmetic mouthwash may temporarily control bad breath and leave behind a pleasant taste but have no chemical or biological application beyond their temporary benefit. Whereas therapeutic mouthwash, by contrast, has active ingredients intended to help control or reduce conditions like bad breath, gingivitis, plaque, and tooth decay. So now let's take a look at the active ingredients which are present in the mouthwash. Cetylpyridinium chloride, which is added to reduce bad breath. Essential oils and chlorhexidine, both of which are used to help control plaque and gingivitis. Fluoride, which is a proven agent in helping to prevent decay. And peroxide, which is present in several whitening mouthwashes. There are instructions written on most of the mouthwashes as to how they're supposed to be used. Generally, 10 ml of the solution is swished in the mouth for about 1 minute, and the drug is retained in the mouth due to its property of substantivity, and the bound drug is released slowly over a period of 8 to 12 hours. Hence, it is advised to not rinse your mouth with water or any solution or immediately following a mouthwash. 70 to 90% reduction in the plaque score is seen following this method of using mouthwash, and this is to be done 1 to 2 times a day. Many people use mouth rinses as a part of their routine oral hygiene. Although rinses impart some benefits to users, improper use of mouth rinses may result in various side effects, such as extrinsic staining of teeth. There could be brownish black discoloration of the teeth, which can be removed by professional scaling. Painful dyschromatic lesions can be seen in the gingiva, which could lead to burning sensation and difficulty in eating. Impaired taste sensation can occur, and in extreme cases, there can be a parotid obstruction followed by swelling. Lemus Jr. and Miguel Viloria published a study in Brazilian Oral Residents 2008, reviewed evidence about the safety of the daily use of alcohol-based mouth rinses. And the authors concluded that despite some undesirable effects to some people, like burning sensation and some contraindications like the use by infants, alcohol addicts, and patients with mucosal injuries, there is no reason to avoid the use of alcohol containing mouthwashes as long as they are used following proper guidance by dental professionals and the manufacturer's instructions. So, this doesn't mean that you should not use mouthwash. It is quite beneficial for maintaining your oral health, so you should use mouthwash, but only according to the instructions which are written on the bottle. And if you're using mouthwash on a daily basis, it is always advised to use it for 10 days to 2 weeks. Following that, take a break of about a week, and then you can resume using mouthwash again. The cycle is to be repeated as long as instructed. So these were a few dental myths associated with toothbrushing, flossing, cleaning tongue, and use of mouthwash. I hope you have liked this presentation. Please do like, share, and subscribe to the channel and support this small initiative of imparting oral health awareness. Thank you.